Hi, I'm Jessica Roberts, and this is my video assessment for an Alzheimer's patient. So to begin the assessment, I'd come in the room, wash my hands, make sure I had all my equipment ready, and introduce myself to the patient. Hi, I'm Jessica Roberts. I'm your nurse, and I'm here to do your assessment. Can you tell me your name and birthday?
Michael Roberts, October 25th of '89.
Perfect. Thank you, Michael. So to begin my assessment, I'm suspecting Alzheimer's disease, but I want to ask health history questions and do a physical exam to make sure I can rule out other conditions that might copy the symptoms of Alzheimer's disease. So, Michael, have you had any head injuries or recently?
No.
No? Have you experienced any concussions?
No.
And been in a car crash
No.
recently? These help me make sure to know that it's not memory loss due to a concussion or other brain injuries. Michael, have you been diagnosed with heart disease or dementia?
No.
These are risk factors of Alzheimer's disease that could increase the chance of my patient having Alzheimer's disease. Michael, in your family, has anyone ever been diagnosed with dementia or Alzheimer's in your immediate family, like a grandpa or dad?
Yes.
Yes? That increases, is a risk factor as well for Alzheimer's disease. Michael, are you taking any medications, and if so, what are they?
No.
No? Alright. Sometimes medications can cause symptoms of Alzheimer's disease as well, so it's important to rule that out. Alright, so my physical assessment, I'm going to assess 3 basic areas, ones that have to do with speaking, hearing, and movement. To begin, I'm going to start with the head, neck, and face. I'm making sure that the head is symmetrical, that there's no tenderness or abnormal texture in the hair. Michael, are there any tender spots or uncomfortable places
No.
that you're having troubles with? All right, then I'm going to move on to his face. Can you smile for me and frown? Perfect. And open and close your eyes. Great. So by doing these assessments, I'm testing the cranial nerves. In Alzheimer's patients, it's a degenerative disease that causes plaques and neurofibrillary tangles that can inhibit some of these movements. So it's giving me a better range of how far the extent of Alzheimer's disease is, or if it's even Alzheimer's disease. So I looked at the symmetry. He was able to move in his face. Can you feel this?
Yes.
Great. Next I'm moving to, can you press against my hand and turn your head towards me? Great. And resistance. Perfect. So that was able to see how strong his muscles were and if they were functioning right. So I'm moving down to his neck. Sorry, I keep saying a lot. I'll try not to. Okay, so I'm palpating the arteries, not both at the same time. And then can you push your shoulders up? Great. That is also another cranial nerve test as well. Okay, so everything looked good for his head, face, and neck. Next, I'm going to go on to the eyes because they have a lot of cranial nerves associated with those. So I've got my equipment. I'm going to perform the peripheral vision by confrontation. So Michael, can you take this and hold it up to one of your eyes, and I'm going to do it as well, and keep your eyes stationary, and as I move my finger, I'm going to test your peripheral vision, and tell me say now when it disappears. Sorry.
No.
Okay, up.
No.
Down.
No.
Sideways.
No.
Alright, great. And then we would switch eyes and proceed to do the same thing there. Your eyes are great. Let me test your coronary light reflex. Great. Perfect. I'm just testing your eyes to make sure that your pupils respond equally, and they did. So I can rule out hearing loss, or next I'm moving to his ears. Then we can rule out hearing loss as a symptom of Alzheimer's. I guess what I'm trying to say is that he has hearing loss that could cause him to have symptoms like Alzheimer's. I hope that makes sense. Alright, so I take my otoscope and check in his ears to make sure there wasn't any obstructions or that his tympanic membrane wasn't bulging or discolored. So I did that to both ears. They look great. Inspecting the skin as well. And the whisper test. I should explain this to you first, sorry. So I'm going to whisper something in your ear and tell me the word after I whisper it to you.
Apple. Cat.
Great. So he was able to hear clearly out of both ears. Next, the part of the assessment is the upper extremities. For an Alzheimer's patient, I am mostly looking for range of motion and muscle strength. So, Michael, can you bend your arms up and down and put your arms side to side and then up behind your head and back behind your back? Great. Your range of motion looks awesome. Next, we're going to squeeze my hands. I'm checking for your strength to make sure they're equal on both sides. Great. And now let's do the sorry. The Allen's test. This is checking your circulation. Where it doesn't pertain to Alzheimer's, it's still important to make sure that you've got adequate circulation. Alright, so I'm squeezing your arteries here, and now open your hand. It's pale. I'm going to release and check for the color to return within 5 to 6 seconds, and it did. So you have adequate circulation. This concludes my assessment portion for an Alzheimer's patient. I wanted to make sure that the muscle strength was appropriate. I wanted to make sure that the vision, hearing was appropriate as well, because that can cause disability in sight and hearing, which would make a patient exhibit signs of Alzheimer's as well. So to conclude, I want to teach my patient, I just need to stop saying I'm teaching my patient, Michael, I'm going to teach you about some important things to be aware of, because I suspect that you have Alzheimer's disease. So the most important thing is safety. So if you're getting up in the night, or if you find yourself getting lost, make sure that you tell somebody where you're going if you leave the house, as well as if you get up in the night, make sure there's adequate lighting. If there's stairs in your house, be especially careful, because movement and disability can decrease. As well as it's important to note that so depression is also common in Alzheimer's patients as well. So if you're feeling sad or lonely for longer than a week, 2 weeks, let somebody know so that we can get you the help that you need there. Some barriers, sorry I forgot to mention earlier, some barriers to assessing Alzheimer's patients would be forgetfulness, word finding, and they can't remember past history. So as I'm asking these questions, this patient may not be able to answer all the questions adequately. That was something I should have mentioned before. However, if he had a caregiver, that they would be a great resource to ask these questions to as well if he couldn't remember. Also, it's important to assess the caregiver for caregiver strain and make sure that they have support groups that they need, because it's really taxing to take care of a patient with Alzheimer's disease. I'd remind him to take his medication, whereas Alzheimer's is not curable. It can, medication can help prolong the effects. And that is it. This is my patient with Alzheimer's, and hopefully we learned something from this.